Hi, everyone. Hi, LinkedIn. It's Alexandra here with MDPen, the brand product specialist. And today I have a very special guest, Kanoe Outram from Hawaii. She is an esthetician. She owns her own business. She has been in the industry since graduating high school. And I know she looks very young, but with that being said, we're looking at almost 2 decades or 2 decades. Yeah.
Yeah.
So, Kanoe, please tell us just briefly about your spa, please.
Oh, yeah. So I am, like she said, an esthetician for actually 19 years now. And I have been working in med spas for a while. And I just decided recently during COVID to open my own. So I just very small business. It's really just me. And so I do chemical peels and microneedling and a little bit of facials, but mostly just for people who are not ready for microneedling or chemical peels, just to have another option to get their skin in a better, healthier place. Um, and it's pronounced Kanoe, which I know is difficult if you're not
Kanoe,
from
yeah.
Hawaii. It's a Hawaiian word, yeah, Kanoe. And the name
Kanoe.
of my spa is Kanoe Lani Skin Therapy.
Kanoe Lani. And she has a wonderful Instagram account. There's tons of great content on there. One thing I really love about what she's doing as an esthetician, a master esthetician, is she's focused a lot on the face and acne patients in particular, which made her an ideal guest for this topic. I really love talking about acne, guys. I guess it was my specialty too as an esthetician, even though I treated a bit of everything. And the
Mhm.
point of these Ask Me Anything videos is that you can ask us anything related to acne, and we will try to answer it to the best of our ability. So I'm really excited. We will do a product giveaway at the end of this video, but we really want to talk about the misconceptions of acne that we see and hear constantly in the industry. And the first one we're going to start talking about is the misconception that when you have acne that you're not clean. And a lot of times when we think of teenagers, especially with acne, they think that they have a hygiene issue. They think that their skin is dirty. They think that they're not, doing something often enough. So what would you like to say about this topic?
Yeah, when it comes to acne, like that idea really breaks my heart because it makes people feel like they're doing something wrong and they're causing it. But really acne is way more than that. I mean, the cleanliness can help to prevent it from becoming too much acne on your skin, but really the cause is just exfoliation within your follicles and an overgrowth of a specific type of bacteria, but it's really coming from the way that your skin is exfoliating itself inside of the follicles. It's retaining too much of the dead skin cells, and so it's a disorder in the skin. It's not something that you're causing. You can make it worse, but you're not going to cause it. You're either acne prone or you're not. So I don't want people to think that they are just dirty and they can just wash it away. And that's not how it works. And actually over washing your skin or over exfoliating is a major trigger for acne because you're disrupting your skin barrier. And so I really focus a lot on barrier health and making sure your skin barrier is healthy and strong. And that really helps the most with preventing and healing acne.
Absolutely. So it's like she said, it's not a cause. And when you're constantly doing this over exfoliating, over cleaning, you're actually stimulating and making things worse. A cause is often genetic. So looking at the teenagers' parents, things like that. So it can make it, worse. Cleanliness just means AM and PM, washing your face morning and evening. If you're doing that, then you have, proper cleanliness for your acne. And one thing I do want to say, and it's going to be our giveaway product, we're talking about MDPen's hydrating cleanser, guys. This is a wonderful gel-based hydrating cleanser. Gels are still the go-to for oily and acne-prone skin types. I know we see, these awesome oil cleansers and foaming cleansers and cleansers that mix and things like this, but gel is still the go-to. It's the best bet. And as we talked about, when you're looking at a full acne regimen, you don't want everything that you're using to be medicated. So if you're using a clindamycin, a benzoyl peroxide, a salicylic acid, or retinol, mandelic, etc. You don't want to constantly be using a medicated cleanser, guys. So this is where this really comes into play. And cleansing with this AM and PM, totally going to help, your cleanliness of your skin. So hi, Suzanne, shout out. Thanks for being here.
Yeah,
So
I
the next
really love
thing,
that cleanser. That cleanser is so good for people who have a disrupted skin barrier because they're able to wash their face without disrupting the barrier because it is really hydrating.
it really is. And it also has all these awesome ingredients for inflammation, which obviously we see a lot of inflammatory acne. So people do, this has marigold in it. This has snow mushroom for hydration. This has HA. It has chamomile for calming. I see a question coming in that revolves around cleanser. Someone's asking, what are some signs that your cleanser may not be, the right one for you?
Yeah, if you notice that your cleanser or after you wash your face, you feel itchy or too dry and tight, if your products afterwards, they sting when you put them on when they shouldn't. If, obviously if it has some alpha hydroxy acid, it might sting a little bit if it's medicated. But if you're just putting on like a moisturizer and it stings, then you probably have a skin barrier issue. And that can be definitely because of your cleanser, especially if your cleanser has ingredients that are very stripping, like or medicated. If it has some acids in it or benzoyl peroxide, it can be a little bit too much. And so you should alternate them and just use it less frequently and use more of your hydrating cleanser.
She answered it exactly as I would, guys. One major sign, which she went straight to, tightness. If you feel extreme tightness after you cleanse, this is not the cleanser for you. So if you're someone, like myself, you have oily skin. So I love that clean feeling. Like I don't want tacky, I don't want sticky, I don't want anything left after I've especially double cleansed, but I also should not feel severely tight. And that's the wonderful thing about a gel cleanser is you can get that nice clean feeling like everything was removed without your skin feeling really tight. And then of course, yes, there's flaking and all these other things. Talking about cleansing, we do have a question coming in about what to do for body breakouts,
Yeah.
acne, as we call it in the industry.
Well, a lot of people think that they have to have separate products for their body, but all the same things that you use to treat acne in your face. I mean, skin is skin, so you can use it everywhere. And actually, your body can handle a lot more than your face can. So don't be afraid to use all of your acne medicated products on your body. You might go through it faster, but I mean, it's there for a purpose. It's there for your acne. So use it on your body too.
Absolutely. And our cleanser, it retails around $32. It goes a long way, nickel
Mm,
size. You could honestly use our cleanser for your body. Also, definitely see a skin specialist,
mm,
whether it's an esthetician who specializes in acne or dermatologist. Let them tell you what type of body acne you have. You may also have folliculitis. There could be other things going on, and they can
mm.
also make suggestions. If you have acne treatments that you're doing for your face that are working really well, um, like Kanoe said, you can use them on your body. So if you've been doing a certain peel, the body can tolerate and withstand even more than the face. So do keep that in mind. But I love using our cleanser. For the body as well. As we move on from this cleanliness topic, I want to get into nutrition, which comes up so much
Mm.
when talking about acne and
Yay.
preventing and triggers. So, what are some misconceptions about nutrition and acne?
Unfortunately, there is very, very, very little evidence, if any, that nutrition can help with acne. I mean, it could, if you're lacking something, then yes, it can help. But for the average person, adding a supplement or changing your diet isn't really going to help very much, or at least there's no real proof that it can. I think maybe people just they want to believe that it helps because it helps them to feel more in control, and obviously eating healthy is good. um, Things that cause inflammation in your body will make your acne worse, so it's not that this food causes acne in everyone. If it causes inflammation in you because you're sensitive to it, then that might be a little bit of a trigger or make your acne worse just for you. But it doesn't mean that's just for everybody and it's going to cause acne or make everyone's acne worse. It's specific for that person. And it all comes down to inflammation in your body.
Yeah, and scientifically, if you ask most dermatologists, they will tell you that perhaps the hormones in dairy, that's a link that can be found. Too much salt in the diet, things like this. And
Sugar.
then, like Kanu said, I mean, obviously things like alcohol, gluten, sugar, things that would naturally cause inflammation could make your acne more inflammatory. But I know right now, and I wanted to talk about this, we see it trending on, Instagram with people that are new estheticians or skin influencers. And it makes me sad and upsets me a little bit because some of these things are not triggers for everyone. And the person that has the most triggers in many cases is that acne rosacea person. Rosacea is its own thing, and rosacea has its own triggers. If you keep a food diary and you notice that you do have things that make you break out, for me, it can be avocado or peanut butter. But I also have mild asthma, so I really need to avoid peanuts anyway. But you could have your thing. Maybe for you, it's, chocolate or fried food. But when I see things listed like eggs, like I see that trending now that eggs are linked to acne. And I never
Oh,
heard
yeah.
that once. Yeah, I never heard that once working in dermatology. And correct me if I'm wrong. If there's any derms watching that are telling your patients not to eat eggs, I would love to hear about it. I'd love to know the reasoning, especially if they're organic or, quality vegetarian fed, whatever. But the egg thing, you don't need to scare people about their diet or use it, as a tactic or, I gave the story a few weeks ago when I did a video of a child that came in with his mother and she had him basically on an all juice cleanse. He had horrible acne. He couldn't even see out of one of his eyes. I mean, he needed extreme treatment measures and she could not understand. And she was, she thought she was doing her best, but she couldn't understand why this acne wasn't going away and only linking it to food. Guys, I've posted Kanoe's Instagram here. Would love for you to follow her on Instagram. There it is, so you can find it. I'm going to leave this up on the screen for just a moment here. But my advice to you is definitely keeping a food diary and things like this. Suzanne, who's watching, is also an esthetician, and she's saying, yes, one thing you can always do is ask about, possible gut allergies. Obviously, people can take a probiotic, things like this.
Right.
Just
Yeah.
touching on.
I think it comes down to like the specific person and what triggers inflammation in them and what they're sensitive to. So it's not going to be everybody. It just depends on the person. And so definitely keeping a food journal, but using those blanket statements and saying this food causes acne or this food triggers acne is wrong because it doesn't in everybody.
Definitely. Yeah. Not as a rule for sure.
Yeah.
So the next thing we can talk about, I would say, would be like lifestyle choices affecting acne and things you can do preventatively to help with acne. Obviously, and I saw someone already mentioned it in the comments, teenagers that play certain sports, this can play a role. You have things like helmets and baseball caps and clothing. And I know myself, I would tell my patients that work out, they need to be wearing dry fit clothes. Don't wear heavy cottons. You will get back knee or folliculitis and things like this. So I would love to hear from you any lifestyle, recommendations or things that can affect.
Yeah, definitely. If you're working out or sweating, you want to make sure the sweat doesn't stay on your skin because sweat is definitely a trigger for acne. Also, sun and heat. You don't want to be exposed to that. That can definitely be a trigger. And that's also another myth is that people think that sun is going to help clear their acne, but it's actually that's proven that will make your acne worse. And so you definitely want to avoid the UV as well as the heat from the sun. I don't know if there's anything else that you
That's a
want.
major
Yeah,
misconception, and
yeah,
that's what
yeah,
this
that
video
one.
is all about. Do
Yeah.
not go to the beach to dry out your acne.
You
I live
being
in
from Florida
Florida.
and me being from Hawaii, we definitely hear
Yes,
that a lot because we love the beach. And the beach is great,
absolutely.
but it's not great if you have acne.
Yeah, same with tanning beds, which is an
Mm,
extreme no.
yeah.
People, hopefully not as much now, but I know 10 years ago people were using tanning beds regularly for their acne. I do see more questions rolling in, guys. Just so you
Mhm.
know, the code I put up on the screen will save you money on our website, www.mdpen.co. You can save 10% using that code if you would like to shop for skincare or the cleanser mentioned in the video. Talking about sports and everything, and not being able to cleanse your face right away. Make sure you have our copper HA mist. This is going to be your
Mhm.
best friend for working out. Teenagers, gym bags, outdoor hikers, runners, theme parks, everywhere. It's your best friend
Oh, yeah.
um,
It's a
when
great
it comes to
product.
that. Let me go back up here, see if I can find some more questions. Are toners necessary, and do they help with acne?
No, they're not. They're not necessary. I mean, it can be an easy way, like the copper HA mist. It can be a useful tool if you're on the go, just to get your skin clean and hydrated quickly. But it's not a need. It's something that can be nice and it can be helpful, but it's definitely not something that you have to have.
Yeah, toners can definitely be a misconception. The main purpose of a toner and the reason medical grade skincare lines came out with toners was to balance the pH level of your
Mm,
skin. But if you're using a cleanser, and again, she and I talked about this, don't get obsessed with pH.
yeah.
If your skin specialist is recommending the cleanser and selling it to you, assume that it has a pH
Yeah, the
reason.
average consumer shouldn't even know anything about pH. You don't need to know about pH. It's not important. Yeah, just use a cleanser that your skin feels happy with, and that's all you need to worry about. You don't need to worry about the pH and balancing all of that.
Absolutely. And this product has the zinc in it, guys. So this, would replace the toner. When it comes to acne, the zinc ingredient in here is going to help control your oil, your sebum
Mhm,
production. So after cleansing your face, if you're accustomed to using a toner, just cut that out and you can use the mist. Obviously,
mhm.
you can use this mist for a million other things too, but that's what we recommend here. Let's see. I see some more. All right, I have a question about over-the-counter face masks to soothe acne.
Another not a need. But if you like it and it makes you happy, the face masks are more of an experience, it's like a moment for yourself to relax. And as long as it's not causing any irritation, then it can be nice. The problem with them is they do tend to have a heavy amount of preservatives, and preservatives are not the problem. I'm not on the preservatives or scary bandwagon or anything. Preservatives are great, but in those face mask types of formulations, they do tend to have a lot more than other things. So if you are sensitive to it, it could be a trigger for irritation and a lot of fragrance. But if you find one that isn't like that and it isn't causing issues and it makes you feel good, go ahead. It's nice, but it's not a need. You don't need it.
Absolutely. So it's more for relaxation, things like that. However, if you want to use a mask at home, MDPen's human derived growth factor
Mm,
gel, this can be used as a mask for 20 minutes, and this is going to be acne safe. I apply it myself with a fan brush just so I get that soothing experience. But this is going to
mhm,
restore your skin barrier, help with inflammation, help with your post inflammatory hyperpigmentation. So I would use this. Like she said, there's a ton of preservatives in the over the counter masks, especially, as well as fragrances, and you don't want to make things worse. And even a mask that can claim to be super hydrating will actually be super drying for your skin,
mhm.
and possibly cause issues. So this is a loaded question. She and I will answer it to the best of our ability. What are the causes of cystic acne, and how do we combat them? or itch?
Oh, that's a complicated one. Yeah, cystic acne, it just depends on the grade. Like estheticians definitely can do a lot to help, but there is a reason why we have dermatologists. And sometimes you do need a prescription. Um, Accutane, people are really afraid of Accutane, but it really helps to treat a lot of the causes of acne, the inflammation, bacteria, all of it. And so, um, Accutane can be really helpful if you're at that point and the grade is really high, like a grade 4 acne would be maybe a good candidate for Accutane, or even what's it called, the other medications.
Yeah,
Sorry.
definitely.
Yeah,
I
other medications
agree. It's going to
helpful.
depend with the cystic acne. Of course, it's going to depend if it's male or female.
Mhm.
Obviously, in adult females, we see cystic acne that is linked to hormones. We have the term adult female hormonal acne, and talking about the cystic acne here. So that's a case. And then you have teenagers getting cystic acne, young men in particular getting cystic acne,
Mhm.
which is genetic, hormonal. And as she was saying, I'm not someone who's anti-referral. So if it's an acne vulgaris grade 4 or 5, that's someone that does need to see a dermatologist. And then the derm will decide whether oral antibiotics are necessary. A lot of times you have to complete a trial of trying various oral antibiotics. Sometimes they'll look right at it, and experienced, dermatologists, and they'll say, hey, this is it. Accutane or isotretinoin, the generic, is going to be the only thing that's going to stop this. And, that's going to be, of course, up to the parent as well if the child is under 18. So that's where that comes into play, especially if you want to stop that scarring early on. That's going to be your go-to, but don't expect your skincare specialist or your esthetician to be a miracle worker when it comes to cystic acne, because that's um, its own thing. And oftentimes there is dermatological intervention very necessary.
Usually with
Um,
those, it's a hormonal issue for sure. So you're going to need other types of intervention. Estheticians can help with the inflammation and help speed up the healing and kind of steer you in the right direction as far as home care. But it's one of those times that an esthetician and a dermatologist need to work together.
Yeah, and just to new estheticians out there, don't try to do like when I worked in derm, the dermatologist did acne surgery in office, which is an extraction done by the doctor in the exam chair. And estheticians should not be replicating this for cystic acne
No,
ever.
no.
Um, I hate seeing this done. I see scarring being caused.
Yeah, a big part of being a good esthetician is knowing when not to extract something. That's huge because it's then you become the problem. Like you're picking at a pimple that you're not supposed to pick at. You're supposed to know better. And so definitely knowing when not to be poking and squeezing at something is a part of your job.
Yeah. And these are the types of cystic breakouts where, there's like a pus, an infection released, followed by blood and oozing. And these are patients that the dermatologist does need to see and often will, recommend an antibiotic. I see a question here from Christy tying back to um, cleansing. How about washing the face with cold water to minimize acne breakouts? Does salicylic acid really help?
Washing with cooler water definitely helps with the inflammation, and also hot water can be really dehydrating, and that can disrupt your barrier, and that can make your acne worse and trigger acne. And so, cooler water for sure, yes. And also, as far as the salicylic acid is helpful. It does help with keeping your skin exfoliated, and then it also helps a little bit with the inflammation too. So that can be helpful. Benzoyl peroxide washes, I really like that to use benzoyl peroxide in inside of your cleanser rather than a leave-on because it can be so irritating. even if you have like a 2.5 or to a 5% in your wash, that's enough. Salicylic acid in your cleanser is really helpful. That's also, I think, better than in a leave-in, leave-on treatment. I like those two to be in your cleanser, and it's on your skin long enough to work.
Absolutely. And the thing with benzoyl peroxide too, with cleansers, that can be great for body. You'll see
Mhm,
LHA cleansers
mhm,
advertised for body. With salicylic in particular, it's really clearing out the follicular issues that
mhm,
are, causing the acne. And you do want to be on the more combination to oily side if you're going with a salicylic product. So if you
mhm,
feel that you're dry and dehydrated right now with acne, you would want to go more towards a glycolic direction. But most people with these types of acne are oily, and salicylic is like your best friend. And then
mhm,
going back to the cold water, yes, absolutely. I myself, I take scorching hot baths and showers, but when it comes to my face, I am sure to use tepid or cool water. Also,
mhm.
you see ice being used on the face. Snow globes are great if you're someone who likes that cold sensation for depuffing inflammation. Just get some snow globes off Amazon. It's something you can do at home yourself.
Mhm. It does also help with calming down your oil glands too, so it can help a little bit with oiliness. Obviously, when like temperature is super useful for our skin, but it's very temporary, so it's not a permanent solution. It's not gonna fix anything, but it will temporarily help.
This is a great question from Aaron. Can dermaplaning stop acne?
Do not dermaplane if you have acne. Yeah, definitely not. And and actually that's a good point because I have recently had a consultation where somebody did say that they were treated by another esthetician who dermaplaned their skin when they had acne, and it obviously, as we know, would make the acne a lot worse. And so for sure, yeah, you're not going to be dermaplaning acne at all.
Yes, I
Yeah.
agree. I'm so glad you asked this. I see it done all the time. I'm always watching stuff on social
Mhm.
media, and I do see estheticians, dermaplaning people with active acne. The only
Yeah,
time where you could dermaplane, if someone has a lot of blackheads on their face and it's an issue of,
right.
open comedones, then yeah, they can still be a candidate for dermaplaning. So I'm not saying someone with oily skin and blackheads, but if you have actual pustules, papules, cystic acne,
Right,
you are
inflamed acne. If you have any
inflamed.
inflamed acne, the non-inflamed acne is okay.
Yeah,
If they have a couple of inflamed acne breakouts, I can just go around them, but going back to seeing the videos on social media, I definitely see people going straight over an inflamed lesion, and, it's hard to watch.
yeah, and it's temporary, gratification when the patient, looks and holds up a mirror and they're like, "Oh, my acne's flat now." But you just created a whole new issue with the skin.
Yeah, you just took that bacteria and spread it all over their face.
You spread it,
Yeah,
you disrupted that, hair follicle where the inflammation was
yeah.
present. So get the skin as clear as possible before you, consider dermaplaning
Mhm,
or something like this. But
mhm.
thank you for asking that, Erin. It's a great question. Um, moving right along, let's see what else we have coming in. As a skincare professional, should you ask your client about supplements they're taking and why?
Yeah, you should definitely ask because it's good to know what they're taking because some things can trigger acne. If it is something that's causing inflammation in them, it's not as important as what they're using on their skin, but it's still good information if you just to see the whole picture of what they're
Agree.
doing.
Yeah.
Yeah.
And
Yeah.
really,
I wouldn't count on that to say this is what's causing it. It would probably be the last resort if
yeah.
I'm looking at their regimen and looking at everything and we just can't figure it out, but it's still good to know. I like to know everything.
It's good to know. You can make little suggestions once you know. One I look for is just biotin,
Mhm.
but
Yeah.
even so, the biotin shouldn't be giving you a full face of acne, but coming
No.
off of it, may improve your breakouts some.
Yeah, and that can be a part of the elimination, going back to like a journal, like maybe they can eliminate all of them and slowly introduce one at a time, just like they would with their skincare regimen. It can be just a part of the whole figuring out what is a trigger for them.
Absolutely. Getting back to the mask topic, we have Suzanne asking what we think about the charcoal mask.
It's not a cure. It's something that, if you feel like it makes your skin look nice and feels less oily, I think that that's usually the result is that your skin feels just more clean and less oily. If it's not causing any issues, it's okay. I wouldn't, that's not a product or an ingredient that I would tell people that they need to run out and get. But if you're using it and you like it and it's not causing any issues, then you can keep using it.
Yeah, and I know there's medical grade skincare companies that do carry charcoal mask
Hmm.
that do work well. I always warn people, if you're going to use a clay or charcoal mask, be prepared for some purging. So
Hmm.
I personally stopped using them on myself because I know what comes of using a charcoal or clay mask. Yes, they
Hmm.
do help, absorb oil, but be prepared for them to draw some stuff out of the skin. So if
Hmm.
this person using this mask, has a big event or photo shoot or something, I would not do it.
Yeah, it's not something you should start when
No.
you have anything important, and you can overuse it too. I think a lot of times people use something and they like the result from it, and so they'll use it too often. So that can be an issue with the charcoal or the clay mask. I think of charcoal masks the same way I think of clay masks. So they're
Yes.
useful, but you can overuse them. And also, like you said, the timing of when to start using one too. You want to be mindful of that. I wouldn't use it even probably like a month before anything important, unless you already know that it's useful. Or
Absolutely.
your skin is fine using it and you're past the purging or you're not going to purge. But anytime you start something new, you can expect some purging.
This is a great question, especially for two microneedling experts.
Mm.
What can be done to help old acne scars?
Oh, microneedling is the greatest for acne scars, not active acne, but for the acne scars because it helps with building collagen. Like that's essentially what it's for, is building collagen. And acne scars, those like ice pick scars, that's a lack of collagen in the area. You damage the collagen around that follicle. And so you want to build that up using microneedling, and that really helps a lot with smoothing it out, and it makes a huge difference. There's nothing else that can help aside from laser treatments and other things that work in a similar way to microneedling. So microneedling is amazing, especially if you have like a higher fits and you're more at risk for pigment and like people who can't handle the high energy from laser treatments. Microneedling is safe for everybody. And so that's something that you should definitely do if you have acne scars. There's no product, there's no topical, nothing else is going to help with the ice pick kind of scarring. As far as like the PIH or the PIE, it does help a lot with that too. It helps with brightening and healing. So, yeah, acne scars, that's ideal.
Absolutely.
Is
And
the
that's the best
microneedling for
part
acne
about,
scars.
finally getting someone's skin clear and out
Mhm,
of that acne zone. Now you can go in and treat that old scarring with
mhm,
microneedling or radio frequency microneedling, of course, either
mhm,
one.
yeah.
So yeah, thanks for asking that. I hope you guys have enjoyed this video. We're over half an hour now, but we will answer a couple more questions. Um, let's see. How often should you have a facial to help treat acne?
It really depends. I have some people that will come in every week, and that's not something you need to always do, but it's, with acne, because there's so many things that can cause it, there's also so many things that can help. And so if they come in more frequently, we can do different things and treat it in different ways, which is the best, I think, for treating acne, is having different types of treatment. So sometimes you can help with reducing inflammation and supporting skin barrier. Other times you can focus on with the exfoliation. And so you can do different things every time. If you're just maintaining, it could be every month. Every month is a good, rule every 4 to 6 weeks if you're just trying to keep your skin clear, if you're acne prone and it's already clear. But if you're experiencing a lot, like you're in a breakout, you should come in a little bit more often.
Agree. And acne facials should always be customized. I mean, you
Oh,
can't
for
just have something across the board on the menu as a go-to
Oh,
for
yeah.
anyone with acne.
No.
um,
Yeah.
so they're always customized. I told you guys I would do a giveaway on this video. Please tell me one ingredient in MDPen's hydrating cleanser, and you will win a free cleanser shipped to you. Again, just one of the ingredients in our lovely hydrating cleanser. First person to write it in the comments on any of our platforms will win. But in the meantime, let's answer one more question. Do we use light therapy such as blue light?
They can be helpful. Just my issue with that is if you have a lot of things, then it can be something that you include. But if you're just keeping it very minimal and you're just sticking with the things that we know work the most, I wouldn't have that. It's not very high on my list. It can be helpful, but there are other things that have a lot of proof that can be helpful, like retinoids or chemical
Yeah.
peels. I stick with those. I stick more with the topicals that help with acne more than the light therapy.
I do like light therapy. As a provider, you will need to invest in one of the more expensive lights if you plan on
Mhm.
using it in office. And I don't mean that in a snobbish way, but they just have a higher, wattage. You need to look into the different companies. But if you do have one and have the luxury of using one, I absolutely love them.
Mhm.
Blue light, of course, is great for killing the P bacteria in acne. If I'm treating with the blue light, I still like to go over it with the red light afterwards. So make sure you're doing that and not just leaving the P bacteria, sitting on the skin after using the blue light. So thanks for asking that. Suzanne is our winner. She's named off chamomile as one of the ingredients in our hydrating cleanser. So Suzanne, we will get this shipped to you. I can't wait for you to try our hydrating cleanser. Again, it's super gentle. You can even use it over your eyes to take off your eye makeup. I hope you guys have enjoyed this video. I want to thank you so much, Kanoe, for being on here. And I definitely want our MDPen audience to find you. If you guys are ever in Hawaii, I know I definitely will see her for a appointment if I'm ever there. Definitely check her out if you live in Hawaii. And just thank you so much for being here. I think this might be our longest Ask Me Anything we've ever done.
We
And
love to talk about
we
acne.
do, we do. There's so much to say that hasn't even been said.
Yeah, we
Um,
knew this would happen.
so definitely find her on Instagram. I've shared her at there. And if you guys have any more questions, you can reach out to MDPen or myself. And again, thank you guys so much, and we'll see you soon. Bye.
Bye.